back to the cervical plexus. So the cervical plexus, one of the most important nerves coming from the cervical plexus is the phrenic nerve. The phrenic nerve controls the diaphragm, so your ability to breathe. We like to have that nerve work, and a lot of people it's not. So that cervical plexus, which comes out at C2, C3, C4, and C3, C4, C5 becomes the phrenic nerve. In school we used to say C3, C4, C5 keeps the diaphragm alive. So if you have a cold or a flu, the lymph nodes tend to build up underneath this SCM, exactly where the phrenic nerve is going to be located, and coming out at C3, C4, C5, right in this area here. So it's very common for a nerve root impingement to cause diaphragm paralysis. Because the nerve roots are not going to the extremity, don't think about it, but the most common presentation that I see of this is heartburn. Heartburn. How would that be? Well, turns out that the diaphragm has two sides, and as you breathe, they need to move together. See that little space? That space would be where the esophagus goes through. We call that sometimes cardiac sphincter that holds the contents in the stomach. So if we're breathing, take a deep breath, breathe out, everything stays closed, your stomach contents stay in your abdominal cavity. If you're breathing and then one side comes up first, guess what? Your stomach can slide up a little bit into your chest cavity, and now your stomach content is coming up in your chest cavity, and may get that a little post-nasal drip. May have a little bit of heartburn. You may have no symptoms at all other than this tightness in the lower ribs on one side, and a lot of times this pain on the outside of your hip, because the nerves that go to the outside of the hip are usually the subcostal nerves from T12 and T11. And a lot of times this hip pain is everybody's trying to work on this hip and the pain's not going away. The problem is not sometimes in the hip. And I see a lot of doctors and I'll say, hey, your problem is at T12. Like, there's no way, it hurts right here. No, it's T12. Well, let's fix it. Oh my gosh, you were right. It was T12. I said, good. Let's see how your diaphragm is. Because if you have that lower rib cage irritation, that may be because the diaphragm not working puts a lot of torque on that lower rib cage. So if you have heartburn, if you have this lateral hip pain, if you have this lower thoracic pain, that might be an issue. And unfortunately, it's very common. And I would say that there's not too many weeks that I see less than 2 of those cases, and nobody in the healthcare field, I'm not saying nobody, but less than 0.1% of people in the healthcare field are looking there. So they're not going to see the answer. So what we do typically is we'll find that diaphragm not working. We'll do a hydrodissection, like you see here, a hydrodissection on a nerve root. This is C6 in this case, this is C5, and this is C4 here. But you can see how we can use fluid pressure to push the connective tissue off of the nerve so the nerve can move more freely. And if there was lymph nodes around the nerve, that can cause inflammation. And inflammation tends to cause adhesions. So it makes a lot of sense that there's an injury, like you rip your skin off, and it starts to, and as it heals, it kind of gets pulled back together, that these webs go out and try to stitch everything back together. But if you just have inflammation because of a cold or a flu, and you have all these webs created around this very complex neurological area, the chances of you having a neurological defect becomes much higher. So you have these young people, their spine looks good, they didn't have an injury, maybe they had a cold, maybe they had a flu, all of a sudden, boom, things are not working right. Their endurance is not the same. You can imagine how your endurance would not be as the same if one side of your diaphragm was not working and you were lost at least a fourth of your lung capacity, right? So that's a common problem, and sometimes people don't notice that. I have a few patients. I see so many patients with this. I saw somebody that fell, and after falling, had difficulty breathing, and then after having difficulty breathing, got COVID, and then they really had difficulty breathing. And this young person, we were able to hydrodissect it, and instantly the diaphragm worked. Instantly the person could breathe normally again. Obviously a very happy person, crying for joy. But another example, had a patient came in with lateral hip pain, and the same thing. Like, oh, well, that pain can be from your subcostal nerve. So let's look at your subcostal nerve. Oh, that's the issue. Let's hydrodissect it. Okay, now that pain is gone. I wonder if your diaphragm is not working. Nope, the diaphragm is not working. Let's go up to the neck. Look at the phrenic nerve. Okay, the C5 nerve root is really tender. Let's hydrodissect that. Okay, now the diaphragm is working again, and we solved the problem. So they caused the hip pain coming from the neck that actually started after they had an infection a few years ago. So that's, almost no doctor is thinking in that field, but it's something. It's thinking this way, but it's something that happens all the time. So I think we need to be aware of, one is the effectiveness of hydrodissecting those nerve roots. The other one is that, hey, this diaphragm stops working a lot of times. That's really, really common. What do I see, maybe 60 patients a week, 50, 60 patients a week, and I'm seeing 2 a week, incidentally. I think this is a problem we need to start addressing as a healthcare system.